It's good.
Pretty good.
I'm just recording
Awesome.
the Zoom for the interview. Thanks for
Sounds good.
thanks for letting us do this. Letting me
Yeah.
interview
So
you.
much for taking the
Yeah, thank
time.
you very much.
Mhm.
Yeah, no problem.
And
Yeah.
also thank Lucas for setting it up. Appreciate
Mhm.
that.
What's that?
I was also saying thanks Lucas for setting it up too.
Yeah, Lucas, good work. Team leader, huh?
Uh,
Yeah.
all right. So we just have some questions we got to ask you.
Okay, great.
First, what's your name and age?
My name is Whitney Bruce, and I'm 55 years old.
All right. And what is your academic degree, level of education, and profession?
Well, I have a master's degree in clinical psychology from Antioch University, and I am an MFT, licensed MFT, and I was licensed in 2005. So I've been doing it for a while. I went to school at UCSB undergrad. I got a undergrad degree in psychology as well.
Mm, cool. Yeah,
Who
that
are you
was,
guys?
huh?
Who are you guys?
Oh, I'm Jamian. I just transferred up to San Luis Obispo. I'm in the psych tech program. So that's why I'm thankful to Lucas because and also Mel for his patience because I had to kind of come up here. I didn't expect to have to move up so quick to just jump into school. So um,
Hmm. Okay.
but
Where are you from
yeah.
originally?
Oh, I'm from Santa Barbara originally. I was in
Okay.
their class. Well, I still technically am in their class, but yeah, I just got this opportunity, so I had to take it. So
Wow. Do you like San Luis?
yeah, it's very nice. I thought it was gonna be more boring, but I was like, it's kind of relaxing.
Okay. How about
Uh,
you?
I'm Mel. I'm from Santa Monica, which I know Lucas is as well. I'm this is my first semester of pre-nursing classes.
Okay.
So starting on that
City
track.
College.
Yeah, I'm gonna do my pre-nursing classes there, and then I have a bachelor's, so I'll probably go into a hopefully an RN program or a master's program.
My sister did that. She graduated with like a sociology degree, and then she went to City College and got the prerequisites, and then she ended up getting into UCSF
Oh,
for
really?
her nurse practitioner. It took her 3 tries to get in there, but that's the only place she wanted to go. So now she's a nurse practitioner.
I've heard really good things about it. I was just actually looking into it. And she enjoyed that program.
She loved it, and she's still in the Bay Area. She's able to prescribe, which is what she, was able to, study under some people that they were connections for her when she went for getting a job too. So,
Really, that's awesome.
Mm-hmm.
and Lucas, what are you majoring in?
I'm majoring in psych.
Okay,
Mhm.
awesome.
Yeah, I'm like not really sure what I want to do yet, but I'm like
Yeah.
choosing like this path.
Will you have to take some like chemistry and calculus and stuff?
So there's like multiple when I was like talking to my counselor, there's like different psych courses or like psych like paths that you can
Hmm.
choose, and like I wasn't really into taking like the like chemistry and biology and like calculus and all that. And then there's like
Yeah.
a more social one where it's like communications and the other stuff like that that I thought were more
Mhm.
interesting.
Yeah.
So I'm doing that now.
Okay. Cool.
hmm so yeah, and you already answered the next question for the undergrad and everything. Um what is your what is your occupation and where do you work?
So I work at UCSB in counseling services called CAPS, and I've been working there only since September. And my role is as a clinical coordinator. So mostly what I do is these brief assessments, which are about 15 minutes long, meeting with students that want a therapist or want to know what the resources are for mental health support, either on campus or off campus. And so kind of, briefly get into like what their issues are and then what they're looking for. And then also I have a small caseload of mostly student athletes that I work with, kind of ranging from their own, anxiety or other mood issues, or if they've got a situation that's stressful that they're trying to figure out how to deal with it. Or if they want to get better at performance. And so I have three like student peers, like peers that I train to be like, do some peer counseling and then also do some presentations and things like that. That's kind of like the fun part of my job.
Hmm. That's
And
cool.
then I also work kind of like on the side. I have a few private practice clients as well through a company called Rula.
Hmm. That's cool. So, how would you describe your job, like in terms of the day-to-day activities?
So, about 4 to 5 hours a day are doing these brief assessments with students. And also, there are some drop-in like consultations that I do as well. So, if a student is having some kind of a struggle with mental health, they'll just pop into CAPS and talk with myself or one of the other counselors. And it could be anything from like they're having suicidal ideation to like they got a horrible grade and they can't cope with it. They broke up with a boyfriend, their grandma died. I mean, it could be like a host of different things. But that's the bulk of it. And then we have trainings sometimes as well. So it's kind of good. We get to go to other places on campus for trainings, or somebody in our department will train us on their specialty. That's really good. Sometimes we also have presentations that are going on just in other places where like I'll go to the intercollegiate athletes program or the rec cen or something like that.
Hmm.
And also I worked in student health for 18 years as an alcohol and drug program therapist. And so that was for students. Most of them were referred through housing if they violated one of the policies, or if they were having a struggle with substance use. Also, it was really a good opportunity for nurses and doctors that were seeing a student that might have like a substance use related injury or illness to refer them to our program. And so we could meet with them like in the moment. There's some research that shows that if you meet with a student when they've had like a negative consequence, like for example, students who might have been drunk and fell off their balcony and, broke their ankle, like, and then they come in to see a nurse or doctor and they're like, yeah, so, are you worried about your health? Are you worried about your drinking at all? Because there's therapists here that can talk to you about it. So it was a pretty easy handoff. And, so kind of just worked with students with whatever their goal was.
Hmm.
Yeah.
Cool.
Jane?
I
And
was just wondering,
yeah.
can I ask one?
Hmm.
I just want to ask, do people ever come in and are they just are they sometimes more emotionally damaged from the physical damage, like breaking their ankle, for example, outside of the addiction issues, or
Gosh, I think it's kind of layered, right? It's like there's just so much wrapped up in it. That's why we do kind of a little bit longer assessment the first time we have like a real session with them, just to see like what's going on. Because you see like people who have, longer term problems with substance use. It's like they probably have a family history. They've probably gotten into trouble when they were in junior high or high school. They have less control around their use. They're having negative consequences. And then there's the students that just, it was a fluke. It's the first time they ever got drunk, or it was the first time they ever tried, weed and they had a hallucinogenic experience, or, so it's kind of these other things that are happening that are just like a one and done type thing. But yeah, and yeah, there's a lot of research that shows that, most of the negative consequences happen the first couple weeks of school, because that's when people don't have a higher tolerance. They don't know their limits. You guys know, you're
yeah,
in the college
I did
setting.
that. I went through that experience in my younger 20s. Yeah.
Wow.
Mhm. All
Yeah.
right. And would you say you enjoy your job?
I love my job.
Can you give a little bit more explanation? Why do you love it?
Yeah, I think, well, working at UCSB is awesome because I have all these other professionals that I
Mhm.
can, bounce ideas off of. They ask me. I mean, I've been working at UCSB for, a long time. So I feel like I know a lot of the folks on campus. So good camaraderie. There's always a lot going on campus, like if I want to go, like tonight there's an art thing going on for people that are diagnosed with either autism or some neurodivergence, and I just thought it'd be pretty cool to see that. Yeah, there's just always something going on. Yeah, I've got some family members that either went to UCSB or worked at UCSB.
Hmm.
So that's cool too. It's kind of like it's a community,
Yeah, it sounds like a good community.
Yeah. And I wasn't really getting paid as well as other people, um, other MFTs in the county. So that's why I ended up switching into this CAPS role last September.
Mm.
So I found a way to kind of like find another job on campus that paid a little bit better.
Mm.
We actually just had someone come talk to our class who I would say is sort of your counterpart at SBCC, who does
Okay.
what sounds
Was it
like a
Lacey?
similar role. No,
Allison?
I believe it was
Yeah, I think it
Allison. Yeah.
was Allison.
But yeah,
Cool.
she said I would say I had a pretty similar answer just in terms of wanting to work on more of a team in a job that seems like it can at times be pretty isolating.
Yeah. I mean, I had a situation on Tuesday where there was an active suicidal client, and I was just talking to her on the phone. I was like, this is not a very good way to assess somebody's suicidality. And
Mm.
I had to do a wellness check on her. So we had to like get another involved party to go and check on the young lady. And she ended up taking herself to the hospital to get help. So that was great. But like, that was the first time I was really confronted with like, I need to break confidentiality right now because this person could kill themselves.
Hmm.
So
Well,
it's
good job
really
on
team.
redirecting them to medical services.
We have this, I mean, I could have called the law enforcement, but yeah, she took herself to Cottage Hospital downtown.
That's good.
Was that partly due to your counseling, though, wouldn't you say, or?
Well, so, and this is a student that I'd never even met with before. And it was a situation in which she actually had a long-term community therapist. And so, she was already like had resources, but she was at a point where she was just kind of at her wit's end. So, and I had said, people who are feeling this, serious about suicide, they get a lot of good containment in the hospital and have a medication evaluation and get some group therapy. And that might be really helpful for you. And she actually hung up. And I was like, oh, I don't know what to do now. But so that's when I broke confidentiality and reached out to this other office on campus that does the wellness checks. And it turned out that the young lady had checked in to the hospital pretty quickly. So that was good.
Mm.
I'm glad that that ended in that manner.
Yeah.
Uh,
But yeah, I can imagine that's pretty intense and probably good circumstances under which to have some colleagues.
yeah.
Hmm. All right. So next question. If in your field, do you use any like specific techniques, and like how would you describe them?
Yes. So motivational interviewing is one technique that we use, especially with students who have substance use issues. And it's a lot. I don't know. Are you all familiar with motivational interviewing?
I don't think so, no.
Well,
Okay.
it's a lot about looking at the pros and cons of somebody's behavior and then seeing how ready they are to make change. And if they are, thinking about it, it's kind of shifting them to make some more realistic steps towards making a change. So like if you're like, yeah, my cannabis use is getting really expensive and I'm not, I don't feel very I feel kind of burnt out in the morning, like, okay, what would be a good first step? And then kind of looking at like, well, what are the pros? Like, what do you like about it? So like validating that there is a reason why they're still doing it, but then what do you not like about it? What would be a good goal for you? Like having the person like basically supporting whatever kind of change they want to make.
Mm.
Is
And there's a lot of techniques to doing it, like scaling questions, like how sure are you that you want to make this, change? That's like on a scale of 1 to 10. they might say like, it's a 6 out of 10. Okay, why not a 7? Yeah.
Mhm.
Is part of that kind of like starting off from a place of not trying to close down their thought because maybe people tell them like, oh, you're doing it bad, you're doing wrong. So instead of that, you're trying to say like, hey, let's. I'm going to validate what you're going to say. I'm not going to tell you you're wrong. I'm just going to try to help you come to a
Yeah.
healthier decision.
Yeah. One of the main parts of it is like what they call rolling with resistance, because a lot of times people will be like, I don't have a problem. Like, this is fine. It was just one arrest, or one time that I blacked out. And you're like, okay, I'm glad it was only one time, and you just like focus on the strengths too. But yeah, because, in college, especially like students, this is a lot of times the first time that they really have the independence, and they're really trying to kind of even maybe prove to their family that they can, do it their way, and they don't, there's a bit of an ego that gets in the way sometimes too, and it's humbling, and they already know they're already beating themselves up enough about it themselves. So having an older person say like, you shouldn't drink, that's not going to work.
Yeah, I got you.
Mhm. All right. And how would you characterize your educational journey and did you enjoy it?
My educational journey, I guess, I mean, I was a psych undergrad, but I didn't really know anything about psychotherapy. And I mean, I thought maybe I'll be a teacher. And I was substitute teaching. I was coaching swimming, substitute teaching at Santa Barbara High. And that was super fun. I knew I wanted to coach. I also got a coaching minor. Basically, it's like a certification.
Mhm.
So when I got to coach, like that was great. And I knew I wanted to keep doing that. But I thought, teaching and coaching would be good together. So yeah, I took a couple years after undergrad just coaching and subbing and doing temp work, and like, I don't know, I just want to stay in Santa Barbara, honestly.
Mhm.
Yeah,
And then,
that's true.
it's like hard to leave. Um, and then I just decided, like, I looked into different programs. I looked at Pepperdine. I looked at Antioch, and Antioch was local and it was inexpensive and I could walk there. And so yeah, but it was interesting because a master's program in clinical psychology, you do a lot of practicing on the other students in the class, and you really get to know each other well. And I was a younger person in the program. The average age was 40 actually in the program I was in. And the other people in the program, mostly women, had gone through a career already or had kids or went into recovery or came out of the closet or a lot of different things that they just decided like, I got a lot of out of therapy, I want to be a therapist. And I was kind of like, I don't know, sounds like it's really helpful. And I'd worked with a lot of kids in a school for kids on probation, and I really liked working with kids. I mean, because I was only like 5 years older than them anyway, but um, yeah. So, part of my problem, which I was working on, was becoming bilingual. So, I, I try a little bit, but there's no way I'm going to get to the level that I needed to be able to do the family therapy that needed to be done, honestly, with the kids that were on probation.
Mhm.
So yeah, my path, I mean, I ended up, yeah, I started working with kids on probation. That was it. I was actually a drug and alcohol counselor then. And we did some group counseling that had a curriculum that was really great. It was called Reconnecting Youth. And it was basically like we met with these kids every single day and just got to know like their problems, at home, and their problems with, some of them were in gangs, and just, their substance use and all that. So then I started working at a treatment facility, which is actually on the other side of IV, Devereaux. I worked there for 5 years, and that I was working with kids on the autism spectrum. That was very eye-opening. I had never worked with somebody with autism before, and I worked with in a boys dorm. So there were 10 boys that were like around age 13, 14, like emerging, puberty and like a lot of behaviors. The reason they were living there is because they were just their behaviors were so tough that their families couldn't have them at home. I'm not sure if any of you have worked with people with autism. Yeah, yeah.
Yeah, my last job actually, I worked at a day program to helping young adults with autism.
Okay. So yeah, you know that like routine is so important. And I was a case manager. So part of what I did was help with, you know, the specific goals for these students and like their behaviors, anything from, you know, decreasing self-injurious behavior to just learning like independent learning skills, putting on your shoes and, you know, getting yourself to school on time, things like that. But that was really eye-opening. And then I went to another position at Deborah working with severely emotionally disturbed girls. And yeah, that was good, helping them transition. Like those girls were transitional age. So, you know, 18, 19, getting them into like group homes in the community. And yeah, some of them didn't make it out of they ended up going back to their families or whatever. But yeah, and then I got the job at UC Santa Barbara.
Hmm, cool. And
Mhm.
so what did you learn from your psychology education in school, like as opposed to like your job or your like just life in general? And what do you wish you had learned in school that you didn't?
Right. Good question. Um, like being a psych like undergrad, we learned a lot about research. We learned about other people's research. We learned, you know, some of the stuff. I mean, honestly, that was 1990. I mean, it was so long ago. Some of the research has actually been debunked by now, which is funny. I should probably go back and get another degree. But and then in graduate school, I mean, they don't teach you how to run a private practice at all, nothing about business. And it's like they set you up to just like go figure it out, go work for a nonprofit and go make like 40 grand a year, like if you're lucky, you know, and it's ridiculous because there's therapists out here that are running good businesses and they're making 100 grand, you know, they're doing, you know, better than the 40 grand that you're gonna if you're working for the, you know, Council on Alcoholism and Drug Abuse or some of these other nonprofits that you just not going to make good money.
Mhm.
But honestly, another thing is, you know, working in student health as an MFT, I was not getting paid as much as the social workers. So the social work jobs actually pay better. So if you're wondering, should I do the MFT route or the MSW route? I would say MSW because you can still do anything that a therapist would do. But it opens you up to a lot more jobs.
Hmm.
That's
Okay.
interesting. I didn't know that about the social work degree.
Yeah. And also like, I mean, if you wanted to do like if you want to go to nursing school, like that becoming like a psych nurse could be a good niche as well.
Yeah, it's definitely something that been considering.
Yeah.
It seems like a really interesting track.
Damien?
Oh yeah, I was gonna say. First of all, I didn't know you had your BS. Nice, good job, Mel. That's pretty
Oh,
impressive.
thanks.
Um,
A BA.
I mean, I knew you were smart, but I didn't know you had that. But I just want to say respect to that. Also, um, so I was just saying, yeah, like actually, I have a nurse in my psych tech program who was saying you have less competition if you have those skills and if you have psychology and you have nursing, you're doing good. You're in high demand, let's say.
It's funny because my sister, who's the nurse practitioner, and we consult with each other, even though like she works for One Medical now. But you know, there are things like she'll ask me things, and like today I was telling her about anxiety, about like the way therapy they do anxiety with like kind of like the hierarchy of the things that people are anxious about, and then have people like start with the lowest one to like expose yourself to it and kind of tolerate that distress by using the coping skills. And she'd never heard of that. And it's like that's definitely something that a nurse should know, you know?
Yeah, absolutely.
Mhm.
No, it definitely seems like there's a lot of very overlapping skills.
Yeah.
Yeah,
But Lucas, you were asking also about like different modalities and like motivational interviewing is one, you know, especially using with people with substance use. But I would say the use of DBT is probably kind of the gold standard right now, dialectical behavior therapy,
Mm,
which it's a lot like cognitive behavioral therapy, CBT, but it's a lot more accepting of the feelings that come up. And there's just a lot of little skills that they teach along the way. There's people that are doing like DBT groups, like we have a group at CAPS that's, a weekly group. And then actually there's two DBT groups, but it's just like very helpful for people to accept feelings that come up and then cope with them as best they can.
mhm,
And CBT is much more like look at your thoughts and try to change your thoughts. And so it's a little bit, I don't know, dismisses your feelings a little bit too much.
mhm.
So yeah,
So kind
Damien,
of like how you
Jamie.
were saying earlier, it sounds like your own personal style of counseling is kind of like instead of like telling people no, not feel their feelings, you want to help the person discover the right answers, and so is that also why you kind of for lack of a better word, vibe more with DBT?
Yeah, probably. Yeah. I mean, therapy in general, you can give advice and that's fine, but you really want to ask permission to give advice. So, I mean, there are times where somebody's doing something that's dangerous and you definitely want to say like, I'm really worried about you right now. I'm really worried about this decision you're making or this behavior. But a lot of times it's more like, what do you think about that behavior you're doing? And getting the person to kind of look at the dissonance there and so that it comes from them because somebody else telling them what to do might just make them feel defensive.
Mhm.
Sounds like it's maybe more about like support and understanding versus correction.
I think it's like agree with a twist. That's another motivational interviewing thing. So it's kind of like, yeah, like weed is really helping you relax at night, but I'm wondering if you are getting a restorative night's sleep, because, and then the psychoeducation part, like you don't REM as much when you smoke weed before bed, like things like that, where you could kind of weave in, do you want to hear a little bit more about what the research says about marijuana? And if they're like, yeah, I do, then you're like, okay. But if they're like, no, nah, like, dude, it's working great for me, then you're like, okay, well, I'm here for you if you want to make any changes. So it's
Mhm.
it's like trying it's like being respectful of like what their process is, where they want to make changes.
All right. Yeah, we were like learning about something like that and or about like giving advice and like asking before in my comm class.
Mm, yeah,
Um and yeah, just like so people don't like you want to know if someone wants advice, you don't want to just give it to them because they might not like it.
right. Yeah.
And,
Yeah.
what does a psychologist mean to you?
A psychologist.
Or what does
Ooh.
being a psychologist mean to you? Sorry.
Well, I'm not a psychologist, but I work with a lot of them.
Mm-hmm.
Yeah, they are really knowledgeable about assessing for the different diagnoses. And yeah, they kind of have to do it all because they have to have that ability to bond with the client. And then they also have to assess really thoroughly. Um, and yeah, they have to know good interventions and ways to work with so many different types of diagnoses. They also can like do assessments for ADHD, like that's really in demand. I mean, I went to a training last week and she said that she thought around 20% of UCSB students could be diagnosed with being neurodivergent.
Mm-hmm.
So, like, we're doing as many assessments as possible, but like, we're booked out into the summer to do those assessments. So, but it's important, to know this if somebody really does have ADHD before you give them medication and stuff.
Mm-hmm. Yeah,
But we have a lot of like support for people with ADHD at UCSB too, like different counseling groups and stuff.
that's cool. All right, so we only have two questions left, but I also only have 8 minutes left for this meeting, I guess, because it's a limit on a free meeting.
Awesome.
But we only have two questions left. So, do you have any regrets regarding your academic or professional choices?
The one thing I would have done is become a sports psychologist. And
Mm-hmm.
that I've looked into it recently. It's about $18,000, about a year and a half. There's some classes through a couple of different universities. One of them's just online. It's like Western University. So that would have been pretty cool to do because I really do gravitate towards sports psychology.
It's
Yeah.
not too late.
Sports psychology sounds interesting, to me at least.
Yeah, I know we have actually specifically talked about it in class a couple times.
Hmm. All right, and
The
then
only problem, I think
oh,
you might have to like go where you get the job. So like go live in LA and, work for, I don't know, a big team. I mean, and I'm like, I want to stay in Santa Barbara. So,
hmm. All right, and all right, last question. What is one of the most important lessons that you've learned in your professional journey, that you would like to share with the aspiring psychologists?
Or I guess probably aspiring therapists in this
Yeah.
context.
take care of yourself. Like that's probably the most important thing because you cannot show up to work and be all over the place. You can't show up to work being, hungover, didn't get any sleep, just sidetracked by your own crap. You gotta make sure you have a good support network. You gotta communicate, you gotta be humble, you can't pretend like you know everything. And you gotta keep learning and pivoting because people are changing. Like, I don't know, students are changing at UCSB. I feel like with like all the technology and TikTok and everything, it's like people's brains are changing.
Hmm.
So, but yeah, you got to take care of yourself first. You got to have your own pleasurable activities, like your whole list of things you like to do on weekends that aren't going to destroy you on Monday.
Yeah. Yeah, that's like I think good advice for like being in that field. I don't know, I've like heard like similar things like just being like taking care of yourself first before you can take care of others.
Yeah.
Hmm. But yeah, that was the last question. Thank
Cool.
you for letting us do this an interview.
Yeah.
Thank you so much. Yeah, really
Hmm.
appreciate
Are
it.
you guys going to have to write something up?
Yeah, so I think we're gonna make a slideshow of like the questions we asked and then um like take your like techniques and like analyze them and just talk about like um just everything you said in here we have to like talk about and apply to like what we may have been learning.
Okay. All
Yeah, we
right,
have
cool.
to write an analysis and then we have to pick, I think, three or four topics that we've talked about either in class or in our text to tie in and then like expand on what those mean and how it relates to what you do.
Okay.
Mhm.
Cool. All right.
Yeah.
Well, I would love to see whatever you guys create because
Yeah,
it's always
I'll send it to you when we finish it and submit it.
okay. Awesome.
I'll let you know how we do on it too.
Okay, good. All right. Well, good luck, you guys.
Hmm.
Thank
Yeah,
Thank you.
thank you.
you.
Okay. Bye.
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 Bye.